Would you like to receive handover report? Hi, nice seeing you again. I hope you had a good rest. You have three patients assigned to you today: Mel, George, and Wilfred. Let's go see them now. Mel is a 28-year-old female who was admitted 2 days ago for pyelonephritis and an anaphylactic reaction to Zosyn. She's allergic to penicillins and has a history of asthma, hay fever, eczema, and migraines. She's stabilized and progressed nicely since admission with immediate treatment for her anaphylaxis and an IV antibiotic regimen for her pyelo. She's transitioning from IV to PO antibiotics and is otherwise independent. She has a saline lock in her right forearm, is tolerating her general diet well, and her INO is matched. I've not given her anything for pain in the last 6 hours.
Hello there.
George is a 28-year-old male with an allergy to penicillins, with a history of type 1 diabetes and testicular cancer, for which his treatment is complete. He was admitted yesterday for DKA. He was initially on the DKA protocol with an insulin drip at 0.1 units per kilogram per hour, and his sugars began to trend downward in a stable manner. His pH and electrolytes were stabilizing, so yesterday around noon, he was transitioned from IV insulin to glargine sub-Q with sliding scale regular insulin. His blood sugars continue to look good, and I haven't given any sliding scale on my shift. He also hasn't required any electrolyte replacement since yesterday afternoon. He had nausea yesterday, but nothing like that for me. He has an IV with normal saline at 75 milliliters per hour in the right arm, and he's been advanced to an 1800 calorie diet with carb counts. He's still about 600 milliliters greater in to out during the last 24 hours, but he's voiding well with no complaints of pain. His next bedside blood glucose is due right after shift change. Psych should also be in to assess him today to discuss his stress and anxiety management, which were precipitating factors to his DKA.
Hi, nice to see you again. If you could check my blood glucose soon, I'd appreciate it. I'd like to have breakfast as soon as possible.
Hi, George. I'm going to check in on my other patients quickly, and then I'll be back to help you soon.
Wilfred here is a 78-year-old male admitted yesterday evening with failure to thrive. It's believed he had a fall at home, but we're uncertain as to the severity of the fall, as Wilfred lost consciousness and was found by a neighbor. No fractures or other trauma found upon assessment, but his electrolytes were depleted. We're replacing his electrolytes, and he also has a nutritional assessment scheduled for later today. He has an IV running D5 half with 20 of K at 100 milliliters per hour in the right antecubital space, which keeps beeping, but it is running well and the site looks good. He's on a soft diet for now and his INO are matched. He denies pain, so I didn't give him any analgesics during my shift.
Hello, nice to meet you. I'm quite sure I didn't fall. I'm just here for a little tune-up. Don't you worry about me.
A couple more things about Wilfred. Both the neighbor and the paramedics who were in his apartment said that it smelled strongly of urine. He has been continent overnight using a bedside urinal with reminders. There's also concern from the admitting team about Wilfred's risk for readmission, as apparently he initially wasn't too keen on seeing the nutritionist, but has clearly lost a lot of weight over the past few months as per his neighbors. The neighbor who found him also said that sometimes he hears loud thuds coming from Wilfred's apartment, which sounds like Wilfred's fallen, but Wilfred always denies it. He doesn't have any social network apart from his neighbors, whom Wilfred himself thinks are too nosy and intrusive. So the concern is that if he's discharged back to his original situation, he'll just bounce back here in the same situation. Social work's following. Alright, that's everything. See you later.
Hi, I'm Rose, the charge nurse on today. If you need me at any time, I'm available by phone. See you around.
Good morning. I've just been to see George. He's asking for his pre-breakfast insulin as his breakfast has just arrived.
Hi, George. How are you today?
I'm good, thanks. Feeling so much better than when I arrived.
That's the safety check completed. Everything is as expected. Before I ask you anything more, can you confirm your name, age, and date of birth?
My name is George Hamilton. You can call me George. I was born on April 16th, and I'm 28 years old.
How are you feeling now, George?
Yeah, I'm feeling a bit better, thanks.
Are you in any pain at the moment?
Not right now, thanks.
Do you have any questions for me?
Not right now, thanks.
Is there anything you need from me? Anything I can help you with?
Just the insulin, thanks.
Are you allergic to anything?
Yes, I'm very allergic to penicillin. I had it once and my throat swelled up and I couldn't breathe. I had to go to intensive care. It was terrifying.
Blood pressure has been taken, but you can recheck the patient's blood pressure at any time using the monitor. You can record your vitals on the early warning system chart on the computer at any time.
I heard Wilfred asking to see his daughter. When I went to check on him, he appeared to be confused and diaphoretic. I've taken his temperature and he spiked a fever. What should you do now? I see why you'd like to do this now, but finish with George's vitals, blood glucose, and medication administration first.
I should do some assessments before charting. IV site is patent. Respiratory rate is normal at 18 breaths per minute. Right, that's all of the vital signs documented on the computer. Findings have been documented. Can you tell me what medications you're taking, please?
Just my insulin, long acting once a day, and then short acting 3 times a day. That's about it, I think.
And are you taking any non-prescription medications?
Nope.
Okay, that's medication given. Is there anything you need from me? Anything I can help you with?
Not right now, thanks.
Let me update you on where we are clinically at the moment.
Okay, thanks for updating me on the situation and progress.
Have you noticed any changes in your health between yesterday and today?
Oh, yes, I'm feeling much better, thanks.
Could you please be more specific? Can you describe what's feeling better?
Oh, sure. I'm not nauseous, and my headache's much better. I feel like I have more energy. I really felt terrible yesterday.
Let me update you on what's going on at the moment.
Thanks for that update.
It sounds like you've done everything there is to do right now. Great work.
Hi, Wilfred. Nice to meet you.
Hi, nice to see you.
That's the safety check completed. Everything is as expected. Before I ask you anything more, can you confirm your name, age, and date of birth?
I've always been called Mr. Price at work. You can call me, Wilfred, if you like. I'm not sure how old I am.
How are you feeling now, Wilfred?
Oh, I don't feel very well at all. And what are you doing here? Is it time to go home yet?
Have you noticed any changes in your health between yesterday and today?
I feel just fine. Is it time to go home yet?
Do you have any questions for me?
Questions. What do you want with questions?
Is there anything you need from me? Anything I can help you with?
I'm fine. I can manage on my own, thanks.
Wilfred, you are in the hospital because you're not too well at the moment. We'll find out what's going on and give you some treatment. Don't worry, you're in exactly the right place.
A hospital? Oh, I'll get out of here. I thought I was at work. I do feel a bit off.
Wilfred, do you know if you have any medical problems we should know about?
Oh, yes. Now, what they are, I couldn't say.
Have you had any previous surgeries or general anesthetics?
What are those?
Can you tell me what medications you're taking, please?
Yes. Um, uh, hmm, now then. Uh, well, they just slipped my mind. Oh, crap. Sorry, I don't remember. I'm feeling a bit tired.
His medication list should be on the computer if you need it.
And are you taking any non-prescription medications?
Nope.
Are you allergic to anything?
Oh, just cats. Well, they make me wheezy.
Can you tell me about your living situation?
Well, this is a very intrusive line of questioning. I don't think it's any of your business.
How do you manage around the house?
You know, I really couldn't say. Please stop asking me questions.
Do you smoke?
Well, I think I used to. I can't quite remember.
Do you drink any alcohol?
Who doesn't? Yeah. Well, I must admit, yeah, I'm partial to a glass of scotch of an evening, but yeah, it keeps me young.
Can you tell me about what's brought you in today, Wilfred? Are you feeling unwell?
Why, I couldn't really say. Where am I exactly? Oh, I feel a bit odd.
You're in the hospital, Wilfred. Does anything hurt or do you feel unwell?
Hospital. Well, very good. Yeah, I have to say, I don't feel my normal self. I'm not sure why, though. You seem nice.
Can you give me the background to what's brought you in?
Brought me in. Where have I been brought? I'm not sure.
Are you in any pain, Wilfred?
Well, now you mention it, my stomach is bothering me. Just a bit. It's really low down. Feels a bit like I need to pee.
Can you tell me a bit more? Does the pain go anywhere else at all, like your back?
Oh, no. It's really not a bother.
Blood pressure has been taken, but you can recheck the patient's blood pressure at any time using the monitor. You can record your vitals on the early warning system chart on the computer at any time.
Respiratory rate is elevated. At the moment, it's 23 breaths per minute. Right, that's all of the vital signs documented on the computer. Capillary refill time is 3 seconds. Strong, regular pulse with noted tachycardia. I'd like to bring your gown down to check your skin. Is that okay?
Oh, sure, that's fine.
On completion of a full skin examination, there are no abnormalities identified.
You can view the completed skin assessment chart on the computer.
I'd like to listen to your abdomen with my stethoscope, and we'll need to lower your gown a bit.
Oh, sure, that's fine, but can you make it quick? I have to go soon.
Abdomen symmetrical in color and shape. Audible bowel sounds in all 4 quadrants.
Ah!
Abdomen soft, but there's definitely some suprapubic tenderness. No obvious mass. IV site is patent. Legs appear normal, no pedal edema, calves are soft and non-tender, and there's no obvious erythema. Pupils are equal, round, and reactive to light and accommodating. Findings have been documented.
I'm sorry, I don't have the monitoring equipment right now, but I'll get someone to look for it. Would you like an EKG in the meantime? That's the EKG done. I've left it on the desk.